Welcome back to Houston Life. It is one of the most common forms of hair loss in men, androgenic alopecia, otherwise known as pattern hair loss or PHL. Veradermics is working with local doctors in our area to investigate a brand new treatment for pattern hair loss. Joining us now with more on this clinical trial and who can participate, lead investigator and dermatologist Dr. Megan Kuvian with SBA Dermatology. Dr. Kuvian, it's so nice to see you.
Thank you so much. It's so good to be here.
Yeah, it's been a few years. Okay, so let's just start off. What is pattern hair loss?
So pattern hair loss is the most common reason why people will lose hair over their lifetime in the world. And this actually affects both men and women. We're going to be talking more about male pattern hair loss today, but it's estimated that over 80 million people in the U.S. are affected by pattern hair loss. We call it pattern because men have actually a different pattern than women. When we see this in men, we see recession of the frontal hairline, more of the top of the scalp or on the crown, exactly. Whereas in women, the pattern is different. We tend to see preservation of the frontal hairline, but then they'll start to see more of their scalp kind of through the hair. And so it presents a little bit differently depending on who you are.
We were chatting a bit during the break about a variety of things out there that people have tried for hair loss. Why is there such a great need for this clinical research?
I'm so glad you asked that. I think it's so interesting to realize that there has not been a new FDA-approved option for hair loss in over 20 years. And so right now, for men, we have two options that really leave a lot to be desired for our patients. We have an oral medication that, while FDA approved and is very effective, carries along with it some mood side effects like depression and even sexual side effects. And so, of course, that's the main downside for our patients. And then the topical is an over-the-counter medication that has to be used once daily. It can be irritating on the scalp. And one of the feedback points that I've gotten from patients is actually having to put it on daily and having to look at the area that they're losing their hair is really upsetting and kind of adds to the psychological burden of dealing with hair loss.
It's a reminder, a daily reminder that you have this issue you want to correct.
Yes.
Okay, so talk to us about this pattern hair loss clinical trial. You're heading up this clinical trial, is that right?
So I'm one of the investigators, and here in Houston, we're one of 44 sites across the United States who are doing this trial. So at our site, we're studying an investigational drug, and that's what's being done all across the U.S. And this is an oral formulation medication that's non-hormonal. So it's really different than the currently available options for men.
And you're looking for participants, like if someone out there is watching, they could potentially participate?
Exactly. So we're looking for men who are between the ages of 18 to 65 and who are having the correct type of hair loss. I also want to point out that this is not the only type of hair loss. So we're looking for those who have a receding hairline, thinning on the crown or at the temples. We also ask that people who would like to participate keep their hair length at least 1/4 of an inch long and are prepared to keep their general hairstyle and hair color consistent over the course of the study, which is about 13 months. We also have a website for people who are more interested in participating in the study at phlstudy.com.
And so for people who might be wondering, if they've never participated in a clinical trial, are you paying people to do this? Or like, what's the benefit for them? Like the possibility that this drug might work for them?
Well, it's actually potentially both. So in a clinical trial, I think it's always important to know that when we're asking patients to participate, that we have enough studies to show that this is safe and that safety is always number one, but then they also have the potential to be on this investigational drug and improve. When you're part of a clinical study, as long as you've qualified, treatment is free, so your medication, your doctor's visits, any labs that are required, and also because we're asking for your time to come in and complete these visits, there's actually compensation for that time.
That's incredible. Yeah. So if people are wondering, participation is free, and in fact, you're getting these benefits in return. So let's say a patient out there or someone watching the show right now, they're interested. If someone is enrolled in this study, what can they expect in terms of scheduling over the duration of the study? Are they coming to see you, what, every few weeks, every month?
It's in the beginning, it's actually every couple of weeks, and then the visits do space out over time, but the total length of time we're asking them to commit to is 13 months. There is the possibility of people who have improved on the study to continue on medication and what's called an extension afterwards, so there may be longer than 13 months of therapy provided.
And what happens at those visits? You're taking photographs of them, you're just seeing if it's working?
So we're making sure that they're tolerating medication okay, not having any side effects. Of course, safety I mentioned is number one. We're also taking photographs of the entire scalp and even honing in on the actual hair quality, looking for, are they having thickening of the hair? Is there more density of the hair?
And last question, so for everyone who's enrolled in the study, will everyone be receiving the treatment you're studying?
That's a great question. As part of the FDA process, in order to prove something is effective, we have to have a placebo control. So there is a possibility that participants could be on placebo. That's a completely randomized process, but I think is a really essential part of it. So I usually tell my patients, if you are assigned to placebo, the main benefit for you is that you're contributing to the scientific effort and to having more medications available for people who are affected.
Absolutely.
By this type of hair loss.
Well, and the more it's studied and the more treatments that become available, fewer people will be dealing with this. 80 million people in the U.S. That's a staggering number.
It is.
Dr. Megan Kuvian, it's great to see you.
You too.
Yeah, fascinating
Thanks so
study.
much.
I have a million more questions. Sadly, we're out of time. Dr. Megan Kuvian, SVA Dermatology. By the way, please note this segment is sponsored by Veradermics Incorporated, supporting research of its investigational pattern hair loss treatment. And that website, once again, for more info, phlstudy.com.